welcome again, everyone. Next slide, please, Jermaine. That's perfect. That's perfect, the agenda. So today, as Jermaine said, we will, really this time is for you to ask any questions you have of the team. It's an open Q&A panel, but before we do that, we do have a couple of reminders. We will start, of course, with our annual enrollment timeline, as we typically do. Just a reminder of the dates. The very first date being that today is the start of annual enrollment for our active and pre-65 employees. So we'll talk more about that. We'll talk about Quantum Health, of course, our new health coordination vendor that we're so excited to work with. And we will also have some general updates and reminders that we like to just bring to your attention. And last but certainly not least, your questions. We want to hear from you what questions you may have about annual enrollment. Next slide, please, Jermaine. Perfect. All right, so as it's building that beautiful animation there, this slide, of course, might look familiar to those of you who have joined our webinars in the past. It is our annual enrollment timeline. It's the year-long process that ends with your employees having benefits for 2025. So the pieces we'll focus on today will be the October to November section in purple and that December to January section. So as we just talked about, annual enrollment has begun today, October 16th. Your employees can go in to the site and make elections if they so choose. As a reminder, this year is a passive enrollment year. So in other words, unless your group decides to no longer offer a plan, members' plan choices will roll over into the new year. So if your group did decide to no longer offer a plan, then your employees would have to make an active selection. But if not to worry, passive enrollment year. And that goes for our medical and our dental plans. Also, we do want to note the December through January period for member ID cards. Please note that following annual enrollment, members in the Anthem and Cigna plan networks will receive new ID cards with a new plan number, and members must share this new ID card with their doctors, their pharmacists, and other providers, except for dentists and vision providers, as their old card will not work after December 31st, 2024. So really, really important. Again, members in the Anthem and Cigna networks will receive new ID cards, and it's important to share them with doctors, pharmacists, and other providers, except dentists and vision. So for vision, IMED Vision, that number will stay the same, and members can continue to use that IMED number with their vision providers. We also say a great way to pull up the IMED Vision information is through the IMED app. All right, on to the next slide, please. Thanks, Jermaine. Quantum Health, the next slide. Fantastic. So we are excited to be working with Quantum Health, the pioneer and leader in healthcare coordination. So Quantum is the leader in the field of care coordination. They have in-depth knowledge of the healthcare industry for over 2 decades of experience, and they'll help our members who use the Anthem and Cigna networks make the most of their benefits. So health of our members, of course, is important to us, and that's why we're adding this coordination through Quantum. They will serve as a single point of contact for members and providers, and Quantum will also ease some of that administrative burden associated with healthcare. So think about the services that were provided through Health Advocate. Quantum will now be doing those services, as Health Advocate will not be available after December 31st, 2024. So again, Quantum will support members in the Anthem and Cigna networks as they navigate medical, prescription, and behavioral health needs, and also access the EAP Employee Assistance Program. Members can still choose their own medical providers in and out of network and contact them for health concerns and appointments. And we do want to make a quick note. This is for members in the Anthem and Cigna networks only. So our Kaiser members and those in the Hawaii service Medical Service Association will have their own comprehensive service and support embedded in the plan, as always. Next slide, please. All right, thanks, Jermaine. With that, I'll pass it over to Anthony to talk about our point solutions through Quantum.
Thank you, Akina. And I'm going to go quickly through these point solutions. I know these are in a lot of the materials we supplied. I touched upon this a little bit last week for those who were able to attend the EBAC. But one of the very exciting components of partnering with Quantum is we're able to fully integrate our point solutions within their solution. So if you think of something right now, like we have Hinge Health, it kind of sits there out on its own, and members have to engage with Hinge Health on their own. With Quantum, it's more integrated, where when members would reach out to Quantum, they'll be able to, and if necessary, refer to these programs just by contacting Quantum. So with that, we are looking at 3 new point solutions for 2025. And again, as Akina mentioned, these would be through Quantum, so they would be for our Anthem and Cigna members. The first one is Teladoc Health Services. So again, I'm going to use the word integrated a lot. Teladoc is fully integrated within Quantum Health. So that means as long as they're able to, whether they're talking to someone at Quantum or through their web or app, they're able to access Teladoc services. So again, these will be replacing the current telehealth services that are available right now with Cigna and Anthem. They're called MD Live or Live Health Online. So again, this Teladoc virtual platform will be replacing those. And it's, to me, it's a little bit more enhanced than what those services are. The engagement in the current services are not high because most people use them for generally acute situations, where Teladoc is a little bit broader than that. It could be used for general medicine support and also to diagnose some common conditions, and those include mental health conditions. And the doctors on the phone could recommend treatment and, if necessary, write prescriptions for members. The other component of Teladoc we're really excited about is access through their primary care physician model. So one of the things we're always looking for our members to do is engage with a primary care physician or PCP. We're generally in line with benchmarks. Our older males tend to fall behind in seeing a PCP. So through Teladoc, it's another access point for our members to set up those appointments. Again, those are generally for adult wellness and for preventative care. Like I mentioned before, if necessary, PCPs can write prescriptions. They can also order lab testing or imaging, or refer them to any external providers outside of the Teladoc platform. Under this program, the PCP program, members can expect to see a PCP within 5 office days. So as many of you could attest, when trying to set up PCPs, even with people you have relationships with for many years, it could take a lot longer than 5 days to do that. And then subsequent visits are usually set up within a 1 to 2 day time frame. So again, a little bit easier access to see these important providers. Next is Magellan Healthcare. Magellan Healthcare is, I would say, a lever or an additional support for the behavioral health of our members. And they are, again, a point solution that is integrated within Quantum's ecosystem, and they're there to help manage complex mental health journeys. So they help members by educating them on exactly what to expect throughout any treatment process, and then also locating any community resources or support groups, and following up with our members to ensure that all appointments are kept. Additionally, there's a transition of care specialist that evaluates members' needs and their potential risk factors, especially when they're being released from any inpatient or outpatient care. And these specialists will support the members with, again, further education and provide coordination and follow-up calls, and will continue with these calls and follow-up until the member is stable and no longer at risk for any admission. And then the last point solution just wanted to touch upon today is through Quantum's Personal Precision Oncology Management Program. And this will provide members and their treating oncologists support from specialized oncologists who specialize in rare and complex cancers. Their support will include case reviews and clinical collaboration. And again, this is in collaboration and coordination with their treating physician, whom we know the members have a trust built with. So again, it's an additional support for members battling through a cancer care journey. Again, it was a quick recap, and we'll be available afterwards to answer questions. But again, the beauty of quantum health is that it's going to take a lot of the guesswork for our members on when or how they'll be connected with these solutions. Members can work with Quantum's care coordinators when appropriate, and then Quantum may recommend them to one of these solutions to ensure they are getting the best care. And next slide. I think back to you, Akina, right?
Yes. Thank you, Anthony. All right, the next slide. Looks like it's coming up there. Perfect, that's it. All right. Annual enrollment is here, like we said before. It is October 16th. I cannot believe we are already here in the fall and ready for our employees to go in and make selections if they so choose. So with annual enrollment, we do have support with Quantum Health this year. So Quantum care coordinators will be available by phone. So there's a number 866-871-0629, and we'll get that number in the chat for you guys as well. But by phone, active members and pre-65 retirees whose plans use the Anthem and Cigna networks can go ahead and call that number if they need help understanding plan options, or if they need help choosing the right plan for themselves or their dependents. So Quantum will know the full benefit plan array being offered to members during annual enrollment for 2025, but not the specific subarray made available to any one individual. Members requiring assistance with plan selections will need to know which plans they're being offered before calling Quantum. So that's important to note. So beginning on 1/1/25, when providers ask members next year whether their insurance has changed, the answer will be yes. Well, their insurance information has changed, and they now have a new ID card that they must use for medical, prescription, Express Scripts, and behavioral health services, including EAP. So please note, this is very important, new ID cards for those members that use the Anthem and Cigna networks. Again, iMed Vision, they can continue to use that same number if they've already been enrolled in the plans, and folks can always upload the iMed app to get the iMed ID card information. Medical providers will call Quantum, not Anthem or Cigna, for pre-authorization and claims, and members should call Quantum or access their Quantum account on the web or via the app to verify that all authorizations are in place prior to receiving services. So the Quantum app will be available starting 1/1/2025. As we said before, vision providers will continue to work directly with iMed. However, if members do have questions about their vision benefits, they can absolutely call Quantum, and Quantum can guide them. And if there's anything more, specific or detailed, there of course can be a warm transfer. If members go to the the Anthem or Cigna websites or call those companies directly, they'll be told that they don't have coverage. So we want to be careful with that. Members will be able to call Anthem or Cigna or visit the Anthem and Cigna websites to access historical medical data, like an explanation of benefits, for example, for a period of 2 years. But Quantum will also have access to this data. So our primary message is call Quantum, call Quantum. And members do happen to call the old Anthem and Cigna numbers by accident, for example, Anthem and Cigna have agreed to inform and train their reps about our transition to Quantum. So we want to make this a nice and smooth transition over. We know, of course, there might be bumps along the way, but we want to try to make it as smooth as possible. Up here on the screen, you'll see a sample of the ID cards, and you'll note that there is Anthem and Cigna noted on the cards. The Cigna card actually does have a Quantum logo as well, but both cards do reference Quantum. These are just samples, but this is so that you guys can get an idea of what your employees will receive in the mail when they're receiving their ID card. So these are just samples, but in terms of like the logos and what's on there, this is the direction we're going in at this point in time. So that should be recognizable and identifiable for folks when they get it in the mail. All members should still call CPG Client Services with questions about eligibility and the enrollment process. So that still sits with our client services team. Next slide, please, Jermaine. Fantastic. So the thing to note here, we do want you to have this phone number available, this 866-871-0629. This is the Quantum number. It is available Monday through Friday, 8:30 a.m. to 10 p.m. Eastern time. We do note that you can start calling them as soon as today. If like right after you get off this call, you want to give Quantum a call and see if they can assist you with your questions. We welcome you to go ahead and do that. And please do share this information with your employees. So the myquantumcare.org is the site that members can visit. It is a dedicated site. Right now, the site will have information, just general information about what members can expect starting 1/1/21. And there is an app for that, of course, right? The Quantum app is called Quantum Health, and it's available on the Apple Store or Google Play. The ID cards, the member website, and the member mobile app will be available starting 1/1/25. Another quick thing to note about the ID cards, they will have, and you couldn't really tell from the sample, but they will have the dependents listed on the cards. So the card will have the subscriber name and the dependents listed, and each employee will get up to 2 cards, and they can call Quantum if they want to request additional cards, or of course, they can use the handy Quantum app and upload the ID card starting 1/1/2025. All right, on to the next slide, please, Jermaine. Fantastic. So just a couple more general updates and reminders. The annual enrollment letters are being mailed. Well, actually, they were mailed as of last week. So that now infamous green envelope, it has been mailed and should arrive in your employees' mailboxes. I would say over the next few days or the next few weeks or so. Probably sooner, but depends on the U.S. Postal Service and how well that goes. But they have been mailed, so we do anticipate you'll receive those soon. We also will be sending email reminders for folks to log in throughout the annual enrollment season. So again, it's a passive enrollment year unless your group chooses to no longer offer a plan. And I think we have the link to the generic letter. Jermaine, if you can pop that in the chat, the annual enrollment active and pre-65 former employee member letter. So in case your members ask about, hey, what does this letter look like? You do have that link and you can share it with them. And members can still access their MyCPG accounts without the mailed letter, which is good news. So even if they don't get that mailed letter, they will still get the emails and they can always still log into MyCPG accounts without, seeing any of that material. We have plenty of material on the web as well. As an FYI, for those administrators who support their post-65 former employees or retired employees, there is a post-65 retiree webinar happening tomorrow on October 17th. There are 2 sessions happening for that, one at 10 a.m. Eastern time and another at 2 p.m. And Jermaine, if you can pop that in the chat as well, the registration, if anyone is interested. Again, this is for our post-65 retired employees. Another thing to note is the annual enrollment guide is now available. That's the 2025 annual enrollment guide. We have a pretty easy to remember vanity link. That's www.cpg.org/AE guide. So cpg.org/AE guide. And Jermaine, if you can pop that in the chat as well, we have the direct link to the AE guide. Okay. And another thing to note here, we do want you to know that there is more information available for Quantum. So this is not the end. We'll continue to share more information for you and your employees. There will be a webinar happening on December 12th, and we actually invite you to pre-register for this webinar. And I think, Jermaine, do we have a poll or a tool that we'll use for the pre-registration?
Yes, we do.
Great.
And here we go. Just to piggyback off of Kina, it just says, would you like us to pre-register you for the Quantum webinar on December 12th from 3:30 to 4:30 p.m. Eastern Standard Time? And I want to wait for all of you to say yes, but I see some of you may have time constraints and other things going on, but I'm going to give you a few more seconds. These votes are still coming in. We are almost at 100% of votes. Just waiting 19 more. Okay, looks like it's slowed down. I'm just going to talk you through this last 4 seconds, just in case there's any strike. Oh, see, there was more. There was more. There's more. All right, just check your screen. And if you don't see the poll on your screen, please go to the Q&A window and type in a non-anonymous question saying, hey, please sign me up for the webinar, because I will get your name and email address as long as you are not anonymous if you go to the Q&A window and say, yes, please sign me up. With that, I'm going to end the poll. Back to you, Athena.
Wonderful. Thank you, Jermaine. So we'll look forward to seeing you all on that December 12th webinar. Again, it is for both administrators and for members. So your employees are welcome to join this webinar as well. Well, you'll hear from our experts at Quantum. All righty. And with that, we will open it up for your questions.
All right, we do have a few in the Q&A, and I will start with the first question. Will the new ID card say Quantum or show the Anthem or Cigna plan?
Excellent question. So the ID cards will show Anthem and or Cigna, depending on which plan the person is enrolled in. There will be mention of Quantum on the cards. I believe the Cigna card will actually have the Quantum logo on it, and the Anthem card will have mention of Quantum as well in the Quantum direct line. But that's so your members, in other words, they'll be able to see and recognize that same plan network option that they're familiar with. And of course, we'll provide more details and information on that December 12th webinar, more information about what your members can expect to see. Right now, those are sample ID cards that we had on the previous slides there. So for the latest and greatest information, please stay tuned for our December 12th webinar. We can share the what the cards will actually look like. Good question.
Perfect, thank you. Next question. Will nurse case managers currently provided through Anthem change to be provided by Quantum?
I'll jump in, Akina. The answer to that is yes. So there's a full transition plan for anybody in case management with either Anthem or Cigna. That transition will start in December. And during that time frame, Quantum, if they need to, will outreach to the member, again, to ensure as smooth of a transition of care. So just while I'm touching upon case management, that also includes prior authorizations in place. Those will transfer over to Quantum as well, again, with the idea of trying to make the transition as smooth as possible.
Perfect, thank you. Next question. I enrolled this morning. Even I, as an administrator and my associate, had a hard time finding the Enroll Now button on my CPG site. I finally realized it was the picture I had to click on to take me to the Enroll button on the next page. If I had a hard time, I can guess everyone else will too. Is it too late to add the Enroll Now to the first page when you log in?
Yeah, I'll take that question. Thank you, Jermaine. Good question. Thanks for that feedback. We'll definitely take it back to our web team to see what might be available. Thank you for the feedback. We can tell you on the bright side, when we do send out our annual enrollment letter and email, we do have instructions along with those that give like a step-by-step guide on how people can access their enrollment. So that's one of the resources people can use. Another thing to note is that we do point to the cpg.org/annual enrollment page, which is the main page that we like to direct members to. It has specific information depending on whether the person's a active employee, a pre-65 former employee, or a post-65 former employee. So we typically point people to that website, cpg.org/annual enrollment, and the Enroll Now button is a little more prominent there, but that is good feedback, and we'll take it back to the team. Thank you.
Hey, thank you. Next question. During open enrollment, can we add disability and life insurance benefits? And if so, how?
I could jump in here. The answer is yes. There is not, we typically would do, especially the disability, would be through a survey. That process we do not follow anymore. So if you wanted to add any of these benefits, I'd say the best thing to do would be reach out to your relationship manager on the benefits relationship management team. With the one thing to keep in note, in order to have this effective for 1/1, we'd like to have everything completed by the end of November. So if that's something you're considering, I urge you to reach out to them.
Perfect. Thank you. Next question. Members will register in January, I assume. Is the website quantum-health.com where they go to register?
I can take that one. Yes, that's correct. Quantum-health.com. That is the overall Quantum website. However, myquantumcare.org is really the site you want to go to. Then that's the dedicated site just for our Episcopal Church Medical Trust members. So I'll type that in the chat, myquantumcare.org. And that is the dedicated site. You can even go to it right now and you'll see some generic information about what to expect for 1/1/25. We'll also talk about the annual enrollment support there as well. But yes, there's a specific site for us, myquantumcare.org. Hope that helps.
Hey, Akina, can I just add, the
Sure.
app you can download on your phone is also available, and it's very easy to do, and it's the Quantum logo, the green circle with the yellow pointing finger, and it actually has the Medical Trust logo on it when you create your account there. And as Kina said, there's not detailed information about our plans there yet, but there will be soon. So you can go ahead and establish those accounts on that app, which is really cool.
Awesome. Thank you, Lori.
Mhm.
Thanks for the
Perfect.
question, y'all.
Thank you both. Next question. Where do employees go to find in-network providers through Quantum or Anthem and Cigna?
Yeah, that's a great question. They can, go ahead, Anthony.
Oh,
Actually.
you got it again. I got it.
Okay, you can go straight, and phone gaps, of course. You can go straight to Quantum. They can assist you with that. So as Lori said, the My Quantum Care website or the Quantum telephone number. And Jermaine, if you can actually pop that in the chat, the My Quantum
Yes,
Care
I can.
website, as well as the dedicated number. You can go ahead and call that number and they can assist you and guide you as soon as today. Anthony, did you want to add anything to that?
No, you got it, Akina. Again, we want to redirect. I mean, people could still do searches like on Anthem or Cigna because it is the same networks we're in. But again, just we want to direct people to Quantum again, just to because they'll do detailed searches on the quality of providers any preferences that a member may want to see a certain provider. So again, we want to redirect everyone to Quantum, but again, if they needed to, they could always go to the generic Anthem and Cigna sites to search for providers.
I think we need to check that My Quantum Care site. It's coming up as an expired domain. And one of our participants has pointed that out as well. So I think let's just check on that and see.
I just checked, it's myquantumcare.org. I think they had
there we go.
.com in it. So if
There
you go
we
to
go.
.org, you'll get to the splash page.
Perfect.
Real-time questions. That's excellent. So you'll see in the chat the myquantumcare.org. So make sure you put the .org.
Thank you all for that one. And we do have the .org in the chat now. And I can say it's a question that's coming after this next one that says .com, but I can let you know now, check out the .org and then let us know if that worked for you. But then the very next question is, if an employee is only enrolled in short and long-term disability, will they get the notice of open enrollment?
I believe the answer is no.
Yeah, I believe so too. And if anyone else wants to chime in, our disability folks do not get the annual enrollment letter based on being.
Akina, that's correct. They would need to be enrolled in a medical or dental or both plan in order to get annual enrollment access.
Thank you, Jerry. Thanks, Laura.
Perfect. Next question. Will I need to contact Express Scripts with ID number update?
The answer to that is yes. Sorry. Yes, once the new ID card is received for January 1st, then the new ID number should be, I'm sorry, not contact Express Scripts, sorry, the pharmacy. You would have to contact your pharmacy and let them know of the new ID.
Yeah, Express Scripts will have that information.
Perfect, thank you. Next question. Information received from CPG introducing the Quantum indicates the ID card covers medical, prescription, vision, and behavioral health services. With the new ID, Quantum is now stating that vision is not included. Is that correct?
That is correct. Again, we initially, the reason for that is initially we were going to include the vision on the ID card because Quantum can answer questions for vision and vision benefits. But the reality of it was when a member goes to a provider, they may have problems using that Quantum card or the new card. So again, we're going to encourage members to use the iMed card, which is available through iMed's website, especially when they're seeing a provider. But if they had questions on the vision benefits, they could reach out to Quantum.
Gotcha. Thank you. Next question. For adding disability, MAP allowed me to enter the date 1/1/25 and then submit. Would this way allow me to enter these benefits as opposed to my relationship manager?
Akina?
Rob, do you want to take this one?
Well, I mean, well, first of all, in case there's any misunderstanding, this is only for annual enrollment for healthcare benefits. It's not for open enrollment for disability benefits. So any specific question around disability probably cannot be adequately answered in this webinar. Specifically to your question, I would encourage you to contact your relationship manager for a more specific answer to that question.
I do want to add just a couple of things. If they're able to add an enrollment date or an effective date of a plan in MAP, that is enrolling an individual in a plan that's already been adopted or is already available. Disability and life insurance should be enrolled within 30 days of the new hire event. Or eligibility for coverage. So the coverage that you're adding through MAP should just be for that employee. If you need to adopt those plans because you've not ever had anybody enrolled in them, or you want to change something about your plan offering, that is what you would go to your relationship manager for. If you have an employee that was not initially enrolled in disability or life insurance, and you offer the benefit, there is a potential, depending upon the type of disability you have, that this is considered late enrollment, and there may be some additional information that has to be submitted. So I would suggest, if this is for individual employees, that a phone call be made to client services to talk about the late enrollment process or the process for enrolling employees if you already have the plans available.
Perfect. Thank you all for that one. Next question. Please confirm that employees enrolled in the EAP only plan will not receive the AE letter.
Yes, we can confirm that employees in the EAP only plans will not receive the AE letter. Additionally, employees in the dental only plan and EAP only plan, like in tandem, they also will not receive the annual enrollment letter. There's a system enhancement that we're working on for next year that will allow those members to get letters for annual enrollment, and also to use the MyCPG system for annual enrollment. But as of this year, it's not available for EAP only individuals. Thank you for asking that question.
Thank you. Next question. If there is an exception on file, will that be noted with Quantum and not get mixed up with Express Scripts?
That'll touch upon the transition of care process I mentioned before. There are some rare instances. It's mainly with the medical channel management program, where we require most specialty drugs to go through Express Scripts. There are situations, whether it's provider access or different circumstances where there are some exceptions, that would be part of that transition process, again, to ensure that goes over smoothly to Quantum.
Perfect. Thank you. As of right now, that is all. Oh, see, all I have to do is say that's all the questions, and then we'll get another one. Here we go. Next question. I'm an admin, but new to my position and new to CPG. Our organization currently does not have lay staff with health coverage, but will be adding our first employee starting this cycle. I thought this webinar would give more step-by-step instructions. Is there a more detailed training tool that is available?
There is. So glad you asked. Very good question. We actually do have webinars that we've done earlier in the year, like a pre-recorded webinar talking about annual enrollment 101. So the basic steps for annual enrollment. So those are available on cpg.org/AEadmin or cpg.org/ARC. So that's one of the resources you can use for more step-by-step information. And I'm sure there might be other information available. Anyone on the call want to share?
There is an interactive guide in ARC, cpg.org/ARC, that will take you through step-by-step and even give you screenshot pictures of what you will need to do as an administrator with respect to annual enrollment.
Yes, thank you, Bob. That's a great one. That's a really great tool.
There's also the course for new administrator training in MAP as well. That's there on the ARC as well. So that's helpful for anyone new.
Jermaine just put the link in for everyone.
Perfect. Thank you all for that one. And so, okay, next question. If an employee has a disabled child on their benefits, will it go to Quantum, or will the employee need to re-certify their disabled dependent?
There will not be a recertification, so that will go over to Quantum. Again, Medical Trust determines eligibility for disabled dependents as well. So again, Quantum wouldn't be dealing with the eligibility portion. So any disabled children that have been verified already will go over to Quantum.
Perfect, thank you. And now we will allow, Annabelle, I saw you had a hand raised. You are now allowed to talk. You can unmute yourself. I hear you talking, but I just don't think you've unmuted. All right, I will give you a moment, no worries. We do have another question, and that question is there a video presentation of the CBHP HSA plans on the CPG website? I thought there was, but cannot find it. Can you post a link? Thanks in advance.
Yeah, thank you for the question. There currently is not a recording for the CDHP education on the website. I did see Lori unmute though. So Lori, did you want to offer something in that regard? Lori Bagley?
Oh, no, I'm sorry. I agree with what you just said.
Oh, okay. All
But
right.
your relationship manager, we do have that information in decks that we are presenting to various groups. So we're happy to share that information via the deck.
Thank you, Lori.
Perfect. And you also just received the annual enrollment interactive step-by-step guide from the Reverend Bob Griffith in the chat now. And I'm gonna just throw it out there one more time. Do we have any more questions? Oh, there we go. Where can I find the price chart?
Maybe can you elaborate on that question a little bit more? Did you mean the rates for the plans? If the person asking the question doesn't mind elaborating.
Benefit rates?
Okay. For your specific diocese or group, participating group, those would be found on MAP. You would access that through, we had a plan selection period, and those rates would be available there. I'm not sure if that answers your question, or maybe Anthony or Chris.
They could reach out to your benefits relationship manager directly.
Thank you, Chris. Yeah, that's always a great option. If all else fails, your benefits relationship.
Especially since we're beyond the plan selection period.
Good point, Chris. Absolutely. Thanks for that, Chris.
Thank you both. All right, we technically have 12 minutes still open. If you were thinking it, you might as well ask it. I would hate for you to join us for this hour, have a question, not ask a question, and leave with a question. I have all of these wonderful people here just for you right now. All right, with that, Akina, I will turn it back over to you. Thank you all.
Thank you so much, Jermaine. Thank you all for your participation and excellent questions. Of course, this is not the end. And Jermaine, thank you for popping in the chat. As Chris just reminded us, and Lori and others, if you do have questions, please reach out to your benefits relationship manager. They could assist you. We also have our wonderful client services team if you have those eligibility related questions and such. And of course, last but not least, right? We're promoting Quantum. Quantum Health is here to help you with your annual enrollment questions. So please do encourage your employees to reach out to Quantum Health directly. They will be able to answer any annual enrollment questions that your folks may have. And Chris, thank you for the reminder. If you are a parish administrator, please reach out to your diocesan administrator. So just a heads up, if you happen to be on this webinar and you're not an administrator for a diocese or a participating group, reach out to your diocesan administrator. Thanks for that reminder, Chris. All right, folks. Jermaine, I don't think there's other questions. And if there are, again, we're happy to reach out to you afterward. Please help us out with this survey here. Jermaine, I don't know if you want to share any more with that.
No, please. Your feedback really helps us for our programming coming up. Let us know what you would want, what you need, what you like, what you don't like. We're here for you and we're open. Thank you.